So, first of all, thank you for making the time to come to today's session. It's a session that is targeted directly at people who are supporting people with a disability directly. You're the people out there that have relationships and contacts with the people that the National Disability Insurance Scheme is all about. So thank you for making the time. I appreciate that many of you have come in your own free time. So that's a real show of your commitment to find out about this scheme and how you can assist the people you work with to know that it's coming and how to be prepared for it. Before we start, I'm Sarah King. I'm from the ACT NDIS Taskforce. I'm joined by Judith Davis Lee, who is a director with the National Disability Insurance Agency, and the agency is the entity that will be running, managing, delivering the National Disability Scheme in Australia, in ACT from 1 July this year, as it is throughout Australia. Before we start, I would just like to pay my respects to the traditional custodians of the land we're meeting on today, the Ngunnawal people, pay my respects to their elders and leaders past and present, and acknowledge and welcome any Aboriginal and Torres Strait Islanders colleagues who are here today. So, also like to thank the Disability Learning and Professional Development Network for putting on these sessions. There will be more sessions across the ACT for workers to find out about the National Disability Insurance Scheme. This is one of many more to come. I'd just like to say before we start, the reason it's so important that we have sessions for direct workers is that you are really the face of the service system. You are the people with whom people with a disability rely for information, not just support and services, but for information and probably for a sense of optimism and confidence about what's coming. There has never been a larger, more significant change to the human service system in Australia. It's a monumental change, and there will be challenges, trials, tribulations through that journey. But it is, as you'll hear from Judith, one of the most important changes in order to ensure that people with a disability can lead good lives. At the end of the session, you'll have the opportunity to ask questions. If I could just ask you to check your telephones before we start, make sure they're switched off or on silent. And I'd just like to hand over to Judith Davis Lee now. Thank you.
Hello everybody. It's lovely to see a full room of people, which means people's interest in what I'm going to talk to you today about is high. So thank you very much for coming. I really appreciate it. As Sarah said, I've been with the agency, well, Sarah didn't say that, but I've been with the National Disability Insurance Agency for almost 2 years. So I joined them in June 2012, when it wasn't called the agency yet. It had a much longer name. I think it was the National Disability Insurance Scheme Launch Transition Agency, which, believe me, is a mouthful. So NDIA is much better. Today is the 1st of April, yeah? Well, I'm not here to play a practical joke. The NDIS really is coming to the ACT, and in fact, it's coming in 3 months' time. Oh my God, 3 months' time. There's an awful lot of work to do before we open the doors, but we are opening the doors on the 1st of July. We might go to the first slide. So all of you clearly have heard about the NDIS, and all of you, I'm sure in your own way, will know that this is something that has been a very, very long time coming for people with disability. More than decades, probably. But its most recent history began probably back in about 2008, when, after the Rudd government first came to power, they made a commitment to hold a 2020 summit. Does anybody remember that? Yeah. It was very interesting. It was a way of sort of generating big ideas for Australia's future. Well, I think it's safe to say that the NDIS was not just one of the ideas that came out of the summit, it was the big idea that was raised at the 2020 summit in 2008. In fact, it was put forward for consideration, among others, by Bruce Bonahady, who is now the chair of the NDIS board. Bruce himself has 2 adult sons with severe cerebral palsy, has been a service provider, a philanthropist, a leader in the field, and so it was he proposing that this was an idea whose time had come. As a result of that idea, the Australian government then asked the Productivity Commission to conduct an inquiry into the existing care and support arrangements for people with disability across Australia. Again, I'm sure this is something that you're well aware of. The report is some 1,100 pages long, canvassed many thousands of views from people all across Australia. I think it received over 1,000 written submissions. That's as well as the discussions and conversations they had with people across the country. And the resounding conclusion was indeed that we needed an NDIS because arrangements, depending on where you live, were either moderately okay or they were uniformly unfair or fragmented. And so this is one of the legacies of having a federal system where you have state governments with different arrangements in place across Australia. This is an attempt to create a single, nationally consistent, equitable, fair and sustaining scheme for people with disability to make sure that they can live a good life. So it is very new. It's taken quite a radical approach, an approach that I have to say has been trialled in pockets in some places and found to have been quite successful as a type of model. But it is a scheme that will tailor a person's supports to their individual needs. Now this is an enormous undertaking because it's such a radical shift away from the way things operate currently. So at the moment, in all jurisdictions across Australia, you have governments responding to pockets of need, a program is developed, a funding stream is applied, so many people, X number of sessions of service in this time frame. Very rigid programmatic responses to identified need. This new system is going to unbundle all of those arrangements. It's going to unpick them all. Any program that currently devotes dollars to disability supports for people across Australia, eventually that money will be uncoupled from the program. All of that cash is going to flow into a single national bucket for disability support across Australia, which will then give people with disability the maximum flexibility in what they choose in terms of their disability supports, who provides it, how it is provided. But an enormous change. I don't think I need to convince you about that. We're going to use an insurance approach. So what this really means is that vast amounts of data are going to be gathered over time. So we're very, very new. So we've just had 9 months of operation since the 1st of July last year. If you want to think about it in terms of a lifetime, we're a baby, we've only just been born. I think by 9 months kids are generally crawling, yeah? So, we're on our hands and knees, we're making our way forward, but clearly we're going to bump into things, we're going to get things wrong, we're going to have to learn to crawl, that cross pattern, that's the best way to do it. So we're moving towards that kind of goal, and hopefully by the end of the first year, like most toddlers, we'll be on our feet. What the insurance approach does, though, is gather all of the data about the outcomes for every individual. This is what's most important. Obviously, all of us want the scheme to be sustainable over the long term. There's absolutely no point starting something like this and have it fail in 2 or 3 or 4 or 5 years. And so data about the outcomes for individuals, in other words, the disability supports that people are receiving under the scheme, and the difference that actually makes to their lives, in other words, the level of participation they're able to take on because of the supports they're getting under the scheme, is going to be gathered absolutely carefully for every person, monitored regularly. We have a unit of scheme actuaries who've been employed to look just at those things. And so over time we'll get a much, much better picture, an evidence base if you like, about what does work for individuals in their individual circumstances, but also be able to aggregate that data up to say for this group of people this is what seems to work best, and you can see all of that will feed into the future planning for the scheme. So choice and control is central, and I'm pretty sure I don't need to convince any of you about the fundamental importance of individuals being able to exercise choice and control. This is a fundamental human right. And yet the reality is that for people with disability, often they have not had the opportunity to exercise choice or to exercise control over the way they live their lives. And in this scheme, that extends to choice and control over the types of supports they receive, how they receive them, who provides them, and under what circumstances. The other fundamental difference, if we go back to that idea of a need being identified, a program being developed, these are very narrow strictures. So they are not needs driven. All programs have a funding cap. And once you get to that cap, nobody else can access the funding under that program. That's the way it works. This is not a capped scheme. So people are not given a ceiling to which they can buy services that they need. Their plan is constructed according to their individual circumstances, their individual disability support needs. And whatever the figure is that comes out at the end of that process, that is what that person is allocated under the scheme. That's a fundamental difference. It's delivered in local communities, obviously. You are part of that local community, so yay, you're in there, boots and all. And we are working towards national coverage. So I don't think I'm going to need to convince this audience about the importance of starting small, of getting it right, of making adjustments and improvements as we go along to make sure that by the time we get to that point where we're going to ramp up from the first 3 years of trial sites to a rollout that's going to go across the nation, we need to have the settings pretty well right. So these first 3 years are going to be crucial in informing the people who are the scheme architects, all the jurisdictions who've bought in, including the ACT, that we can roll it out in a way that's going to be there for the nation in decades to come and that is going to be sustainable. So this is the picture at the moment. We've got 7 trial sites that are being established over the first 3 years. On the 1st of July last year, we opened our doors and we had 4 trial sites across 7 locations. So they were in Tasmania, where we have 3 shopfronts, the Barwon area of Victoria, which is centred around Geelong. They opened with just an office in Geelong, but they've now got an outposted office in Colac. So it probably should be 8 now. Anyway, we'll get to that in a minute. The Hunter in New South Wales, which currently has an office in Charlestown, and Charlestown sits right on the border of the Newcastle local government area and the Lake Macquarie government area, so it's in between the first 2 lots of people who will come in. And in South Australia, it's the entire state of South Australia. Who's been to South Australia? It's enormous, isn't it? And the distances between places in South Australia are enormous. Nevertheless, they are doing the whole state for a child cohort. So they're doing from birth up to 14 years. In Tasmania, it's 15 to 24 years, so all those young people who are hitting those transition points about leaving school, thinking about post-school options, going into employment. And in Barwon and Hunter, they're doing the entire age group who'll be eligible to access the scheme from birth up to 64. So you can see those 3 pieces will fit very nicely together. Now the ACT is a little bit different again. So even though we're doing birth to 64 here commencing in July, we are behaving in the ACT as if this is full scheme rollout. So we are commencing here because the intention is to bring in every single person with disability who will be able to access the scheme over a 2-year period. So at the moment, the estimates sit at about 5,000 people they estimate will be eligible to access the scheme. And just how we're going to do that, we haven't quite got the answer in, but you can imagine if we open the doors in our Northbourne Avenue office and in Emu Bank on the 1st of July and we get 2,500 people turn up, that could be quite difficult. So there's a discussion going on at the moment between the ACT government and the Commonwealth about how exactly we're going to bring people in. So we need an orderly progression of people into the scheme in the ACT. And what I can tell you is based on the experience from the 4 trial sites that commenced last year, that actually worked very well. So they did it slightly differently in each place. So sometimes it was about ages. So in South Australia, for example, they started with the babies first, bringing in subsequent 2 to 3 year olds, then 3 to 4, then 4 to 5. They're doing 6 to 13 in the second year and so on. In the Hunter, it was a combination of where you lived. So there are 3 local government areas involved. So they said, let's go with the Newcastle LGA first. But there are some complicating overlays which had to do with which people are receiving help under which programs there. In Barwon, it was by program only. So they said all the people who are receiving this support at the moment will transition you over yet. But what I can tell you is it's worked quite well. So there was no riot on the 1st of July last year. People knew when they were likely to be coming in, so they'd had a letter saying, this is when you're likely to come in. So the same thing will happen here in the ACT. Probably the next time somebody from the agency comes to talk to a group like this, we'll be able to give you more detail. At the moment, all I can tell you is the phasing, that's how it's referred to, the phasing, is still being decided, and so that'll be soonish. Yeah, we're very close to an agreement, which is good. WA also joins on the 1st of July this year. That's going to be very interesting because the WA government is running its own NDIS-like trial. It's called My Way. And that's because WA government likes to do things their way. But we will also be opening in the Perth Hills area of WA on the 1st of July. And in the Northern Territory, we're doing a tiny, tiny number of people in this vast area called the Barkly region. I mean, it's just huge, peppered with tiny little remote Indigenous communities. So that is going to be quite a challenge. But you can see all of those bits of experience, if you put them all together, what you've got is something that should reflect diversity across the Australian landscape, including how a scheme like this is possibly going to operate in a remote environment. It's going to be very challenging. So the scheme did start on the 1st of July last year. That was so exciting. Our CEO, David Bowen, said, if I have to stand somewhere just with a balloon that says NDIS, we are opening on the 1st of July. But in fact, everything that we hoped would happen on the 1st of July did. Things have been going quite well. So this scheme is underpinned by developments that happened probably a year and a half ago almost now. So there was a Council of Australian Governments agreement in December 2012. That seems like an awful long time ago. But that was the foundational, general, in-principle agreement, all jurisdictions across Australia saying, yes, we need this scheme. And that, of course, came on the back of the Productivity Commission's report saying, this is something that Australia needs to move towards now. Bilateral agreements between individual jurisdictions who were hosting a launch site and the Commonwealth Government was signed in April last year. So you can see we're in April now, so it's okay we haven't quite finished our arrangements for the ACT yet. And for those jurisdictions who have already agreed that they will proceed to full scheme rollout based on the learnings from the trial, so that is at the moment every single jurisdiction in Australia except for WA, so they're the only ones who haven't signed a heads of agreement for full scheme rollout. So here in the ACT, in a sense, we'll be ahead of the pack because we'll get to the end of our trial period, but in fact everybody who needs to access the scheme will have done that. And I've mentioned those other arrangements in place. The one thing I will say is before we opened the doors on the 1st of July in the trial sites last year, we conducted a number of what we called site rehearsals where we actually brought people in who we suspected might be eligible, kind of ran them through the process, so it was a bit of a dry run to see how it all worked, and that was tremendously instructive. You can construct all your processes and say this is how it's going to work, but until you get real people in there actually doing the processes, you don't find out what could possibly go wrong. And we'll be attempting to do that again this year. So we'll be in touch with you saying, come and give us a run. So I belong to the National Disability Insurance Agency. When we passed the legislation for the scheme, so we are supported by a legislative base, that should give all of you some comfort, I think. So most programs are not necessarily supported by legislation. The legislation tells us what we must do, in what sort of time frame, for whom and how. And it's supported by other things. So You have the legislation itself, and anybody who suffers from insomnia, get a copy of the Act and read it late at night. You won't have any trouble sleeping, like most legislation. But it's supported by a set of rules which are much more lay language. So for me, because I have trouble reading legislation, they make a lot more sense. And the rules sort of flesh out at this conceptual level what the Act is meant to do. And then underneath the rules set a set. I'll just put my teeth back in. Sit a set of operational guidelines, which are the much more detailed advice to our planners, our local area coordinators, people working with the agency about how this is going to operate in practice. All of that material is available on our website. So all of this is completely transparent. And if any of you are looking for it, you'll find it very easily if you go to the section called About Us, and there's a section called Legislation, NDIS Rules, and so on. So our role, apart from actually delivering the scheme, that is bringing people in, getting them planning, finalising plans, connecting them to service providers, getting them going, is also about building community awareness of disability. So we're much more than fund holders, planners, administrators. So in every launch site we've got staff whose sole role, I like this phrase because it's French and I can't speak French, but raison d'etre, isn't that a lovely phrase? I mean, reason for being is to actually engage with local communities. So I did that at a national level. I've now transferred to the ACT trial site where I get to do a little bit of it, which is good. But there is also a Director of Engagement that's been recently employed who was in the ACT government, so that's a really good link. Her name is Alice Tibbetts. I don't know if any of you know her already. But from now until the end of June and beyond, she'll be out there conducting public forums just like this, and there'll be a series of those as we move towards launch. We obviously have a key role and a key interest in ensuring the financial sustainability of the scheme. In a sense, that's everybody's responsibility, but there are people in the agency, as I said, in the actuarial unit, whose absolute primary purpose is to make sure that things are running as well as they can. This will be the first time, by the time we get to full scheme rollout, it will be the first time ever in the history of Australia, and I don't think I'm wrong in saying this, where we have a single body of data about people with significant and permanent disabilities and the effect or the outcomes of the supports that they're receiving on their lives. So we've started collecting that data then. We have a database that's collecting information about the people, the over 4,000 already who have come into the scheme and who have plans. And we will continue to do this. If any of you read even the executive summary of the Productivity Commission's report, one of the key pieces of feedback they had from people with disabilities, their families and carers, was that people hated having to repeat their story over and over and over and over and over and over. So every time somebody went to a new provider, it meant almost inevitably starting from scratch. And people get very tired of that. And so with this system, we will collect that information from people once, where they have bodies of information sitting with other providers that they feel we need to have. We can make arrangements to gather that information with people's consent. But once we have it, their story is there. It is captured. And then when they come in, say they start off in the ACT, and in 3 years' time, that person and their family decides to move to South Australia, for example, we will be able to just shift them across. They'll contact the agency, their information is there, they don't have to start from scratch. I mean, this is one of the beauties of having something that will be a national scheme. It will be portable in the long term once we've hit full scheme rollout, and it will mean that the person only needs to tell their story to us just one single time. I will say, however, because this is interesting, we heard that information many times, even when we were in the lead up to launch. myself and a couple of people from my team went round to each of the launch sites to do some co-design sessions with families and people with disability. And even there they were saying, oh, you know, we get so tired of telling people our stories. But the thing is, when people came in for their first planning session, they were very keen to tell us their story, even if it was only going to be that one time. And maybe it was with the knowledge that having told us just that one time, they didn't need to repeat the details again. We will have a very strong role in developing, enhancing the disability sector. Does anybody visit our website at least occasionally, the NDIS website? I'd encourage you to do so. So ndis.gov.au is the address. The reason I'm saying that is information is updated regularly, and anything that's new will appear on the carousel. So there's this shifting sort of set of headings up to the top right-hand side. Now, there have been some capability grants released just recently. The funding has been announced for that. So if any of you are working for a provider who think they might like to have a look at that, that's open for a month. So I'd just encourage you to go and have a look at that. It's about building community capacity and capability, about organisations that perhaps might like to set themselves up as a disability service organisation. And we will have a role in undertaking research. So we haven't quite commenced, although we have commenced the arrangements for doing a formal evaluation, because that's really important. But in the longer term, the data that's gathered is going to be this very, very rich source of data for researchers, both in the short and the long term. So that'll be very exciting too. So progress to the end of February. So this is pretty well up to date. I don't have March figures because March only finished yesterday. We've had 1,300,000 unique visitors to the website, so that means actual individuals, which is very good. We get around 2,500 visits to the website every single day. More than 5,500 people have actually visited our shop fronts, the 7 that are open at the moment. So these are people who didn't have appointments. These were people just coming in, seeking information or whatever. More than 7,500 access requests have been submitted. So that's the formal mechanism for people to seek access to the scheme, and I'll talk a bit about that later. Over 5,000 plans have now been completed. So we're moving well towards the target for the first year, which is to bring 9,000 people in and have them complete their plans. So everybody's expecting we will hit that target. And very comfortingly to people who work for the agency, the people who have come in and had their first or second or third planning session with the agency report a very high level of satisfaction with that interaction. So we must be doing something right. Now, this is a really important slide. It looks very wordy, but I'll talk you through it. This gives you an idea, well, not an idea, it gives you a summary of how things are changing between the current arrangements and how things are going to be in the future, and for the ACT, that's the very near future, which is good. So on the left, you've got access criteria. In other words, this is how people might access either a program or a source of funding or whatever. Under the former system, that would vary from jurisdiction to jurisdiction. So even though you might have 2 very similar programs side by side, the way that people got access to those could vary enormously. You know, just this patchwork quilt of arrangements all the way across Australia. Very confusing, and particularly difficult if you had a person moving from one jurisdiction to another. Under the NDIS, there is one nationally consistent set of criteria that allows people to access the scheme, and it's set out in our legislation, and then it's supported by the NDIS rule, and then also supported by our operational guidelines. Choice and control under the former system, again, this varied from state to state. As I said, you had pockets of people who were receiving individual support packages, but that is the exception, not the rule. And so most people have very little say over the supports they receive. Under the NDIS, the individual is at the centre of this scheme, absolutely. The individual, their carers and family sit right at the centre, and they are the ones who have control over what they receive and how they receive it. Level of assistance almost always capped. Even with individual support programs, there was often a cap on what people could receive. But under this new scheme, it's absolutely demand driven. And funding, well, we've already talked about, the thousands probably of individual programs. Identified need, program, a bit of money, inflexibility. You can only do this, to so many people over a period of time. That will all be gone now. So everything will be demand driven. And funding. And so we'll have this single funding pool called the NDIS. And the more cash we roll into that, so once programs come to the end of their life, the money that would have been devoted to that program will roll into the NDIS, and eventually we'll just have a single funding pool for everybody who's able to access the scheme. I won't go too much into this, but there are principles and objects in the Act. They're probably worth reading. They give effect to Australia's obligations under the United Nations Convention on the Rights of Persons with Disability. And there are some of them there. Again, I won't sort of go into those. Most of these will be like, yeah, absolutely. Nobody will want to argue against them. But this is where I wanted to get to. So the primary aim of the scheme is to increase participation for people with disability in all spheres of life. However that might look for an individual, to whatever they can bring to the table, to the extent that they are able to do it, we want to increase their participation. This is also consistent with our obligations under the UN Convention. The scheme design actually assumes that people with disability will participate to the extent that they are able. Increased economic participation, because I'm sure all of you know a number of people with disability who would love to work if only there weren't so many barriers, if only they could get the support that they need and desire. But increased economic participation for any person always translates to better long-term outcomes, and the same is true of people with disability. Those higher participation rates, as soon as you've got people with disability much more visible out there participating in whatever aspect of the community we're talking about, eventually that will deal permanently with the social constraints of disability. The scheme is going to work very hard to ensure that other supports, so beyond the disability-specific supports that people need, there are a whole host of other supports to which people with disability ought rightly to have access. So I'm talking about mainstream supports now. Transport, accommodation, health, education, all of those things. Everybody has a right to assistance under those schemes anywhere in Australia. People with disability often have less access simply because there is either nobody to advocate for them, they don't know how to navigate the system, or the system says, oh, it's too hard. Too hard is not going to be an excuse anymore. So that's a big chunk of our work, making sure those systems work as well for people with disability as they do for people without. And the scheme will fund all of the reasonable and necessary disability supports that a person does need to achieve that participation. So when you're thinking about what the intent of a person's plan is, that's really what it is. It's to increase participation. Yep. I've talked about some of this already, so I'll just recap. These are the three pillars that actually underpin the way that this scheme was designed. So if you know about these things, you have in your head really a framework for thinking about what this scheme is designed to do. So there's the insurance approach, which shares the costs of supporting people with disability across the entire community. Who pays tax? Okay, if you pay tax, you are contributing to the scheme. It's not like a normal insurance scheme where you go and buy a premium. In a sense, you are all paying your premium through the taxes you pay. If any of you were kind of listening to what was happening in the lead up to launch last year, there was an amendment made to the Medicare Act, which meant that the Medicare levy, there's a proportion of the Medicare levy which has gone up, and that money is devoted wholly and solely to the NDIS funding. So all of us are, helping to support this in the event that any of us might well need it in the future. You just don't know. So choice and control, I've talked about that. I don't need to say that again, but that's in the middle, and that's in the middle for a very good reason. And on the other side is community and mainstream. So this sits within a philosophy that says People with disability are as entitled as anyone else to access community and mainstream supports. So accessing the scheme, this will be of big interest to you. So once we know the phasing, which is still a mystery to Sarah and I, but once we know the phasing, the agency will write to, and the ACT government may well as well write to people, to let them know when they're likely to come into the scheme. So they'll have a reasonable expectation about when they're likely to be able to phase into the scheme. Now, you might have a question about, well, what happens to them in the meantime? So there is an agreement between all governments who are participating in the trials that existing government programs or continuity of support will continue for people up to the point they actually come in and have a plan. So please don't be concerned that if you have people who you are caring for, who you think may well be eligible, their support will not fall away on the 1st of July. So arrangements will stay in place until individuals actually come into the scheme. So how do you find out? So this is a good question. How do you find out if somebody might be eligible? You can go onto our website right now. Probably Google it on your phone if you want to. Go onto our website right now, and there is an electronic, very simple form to fill in called My Access Checker. So it's been set up for ACT residents. So you can go in, have a look at that, put in a few questions which really talks about the impact of a person's disability on their daily functioning. And at the end of that form, which really literally only takes about 5 minutes to do because I did it for my son who has a permanent disability, you will get a little sentence that says, it seems like you might be able to access the scheme. Here's your reference number, and it'll give you a five-digit and so a combination of numbers and letters reference number. You need to keep that because that reference number attaches to the information that you have put in the electronic form, and it will say, please contact us after the 1st of July. So the reason it says that is we don't still know who's actually going to come in on the 1st of July, but nevertheless it's a useful exercise to go through. So, you know, go on, have a try. Even if you just make up a fictional person or somebody you've worked with in the past, you'll get an idea of what that information is seeking. Yep. But we have a wide gateway. So how many of you have had experience in the past with programs that have had all these things that you need, all these hoops you have to jump through before you even get to the front door? So, you know, you have to have a doctor's this and a, you know, blah that and a specialist this and a, you know, assessment this. No. You guys actually are part of our front door. I don't know whether you knew that. But anybody that you're working with that you suspect may be eligible for the scheme, you can refer them to the scheme. You can sit with them and do the My Access Checker in your office or in their home if you want to. If somebody is even just wanting to chat to somebody, to have kind of a preliminary discussion with somebody about what do I do, you can do that. So you actually are part of our front door, and as such, because you're in direct contact with people with disability, you are going to be very important in the scheme of things. So ACT residents, oh, that says ACT residents, that should say ACT. Anyway, and as I said before, there'll be a gradual intake, you know, just an orderly progression to make sure we bring everybody in a timely way. This is the skeleton, the sort of core of what the disability requirements are. So this is also really important. In order for somebody to access the scheme, and I'm going to talk just about the ACT now, people will need to be aged under 65, so that's really key. They'll need to be residing in the ACT before or on the 1st of July, so you can't just move in you know, on the 3rd of July and say, I'm here. I think you'll find most of your clients are already here anyway. You have to have a permanent disability. So we'll come back to that in a minute because some of you might be wondering, oh, what about people with psychiatric illness where they're sick sometimes and not? But I'll talk about it in a minute. So a permanent disability, and the disability must have a significant impact on the way a person lives their everyday life. So I'll use my son as an example because he has a permanent disability. He has something called velocardiofacial syndrome. Have you heard of that? No, most people haven't. So it's a chromosomal disorder, but like many of those disorders, it's a spectrum disorder. And some children are very, very significantly impacted. Others, like my son, are more at the mild end. So his main effect is a mild intellectual disability. And he, for example, has a terrible sense of direction, among other things. But he does need help with some things. I doubt that he's going to be able to access support under the scheme. But it is permanent. So it needs to have a big impact on your everyday life and your ability to participate. And you are going to need supports for the rest of your life. We'll talk about early intervention in a minute because it does slightly alter the picture here, because you can imagine if somebody has either been newly diagnosed, has just had an accident or an injury that's caused what's likely to be a permanent disability, by bringing in early intervention immediately, you may be able to actually reduce the amount of support that somebody might need over their lifetime. So that's got a really important place in this scheme. And in fact, there are two ways, if you like, into the scheme. There are people who've got a stable, permanent disability, that has a significant impact. They will come in. But people who've either been newly diagnosed or have newly acquired a disability can come in under the early intervention requirements. I won't go through that, that's a pretty thing. So before I just get on to this, I'm just going to mention mental illness, because mental illness can be significant and it can be permanent. And perhaps some of you have clients that you help who maybe have a mental illness. In the ACT, it's an area of particular interest, I would say. We're interested in helping people where we can. Certainly, they are included in the scheme. But you would all be aware that for some significant mental illnesses, or psychosocial disabilities it's also called, they are episodic. So people certainly have a diagnosis that will stay with them for life, but they may be ill for periods of time and then they'll have a period of recovery where they are not so ill. So, can the scheme manage this? I'm confident that we can. The planning and assessment process is flexible enough so that if a person comes in at a point in their lives where they are not so ill, but the scheme gets to know them, records them, at a point where they are ill, help could be activated very quickly. And if you think about that in terms of other people who might have a progressive or degenerative disability, so say motor neurone disease might be a good example. So people's needs for support are going to increase over time. So there's no cure for that, and people generally will get worse over time. As a person's need increases for disability support, they need only contact their planner and make a subsequent appointment, and further supports can be arranged. The scheme is designed to be that flexible. For most people, they will have a default review date of about 12 months. So this is where their disability is stable, they pretty well know what they need, etc. But if anything happens before that 12 months is up, people can just simply phone up. Yeah, that's right. So it's designed to be like that. So this is the three chunks of the things that you will find in a plan. There is a lot of concentration and emphasis on what people's goals are. So I don't doubt that if you tried to have a conversation with some of your clients about goals, they possibly wouldn't know what you're even talking about, because people with disability have had to struggle so hard to get the support that they need and are often making do with much less than they need. It's very difficult for people to think beyond next week or next month. This is a scheme that's actually encouraging people to think about their long-term goals, and this is something that people with disability have a bit of trouble getting their heads around. So we're not just talking about your needs today or next week or next month. What would you like to be doing in, next year or the year after or in 5 years? So the experience in the 4 trial sites to date is that this has been the hardest thing for people to tackle. It's meant that plan completion rates have taken longer because people have needed time to think about their goals. They've sometimes needed assistance to think about their goals. What is a goal? Well, it's something achievable that you want. That's what a goal is, but it has to be achievable and it has to be something that you want. And so there's been a bit of work going into our trial sites now with people who we know will come into the scheme to get them to think about that in a bit more detail. And so they're a bit prepared when they come in to have their first planning conversation. And there's been a bit of work sponsored by the ACT government around that very thing, around helping people to think more carefully about what it is they want to do. And we'll continue to do that. So with each lot of people who are coming in, I don't know how many more of those capacity building workshops.
So probably a few more to go of that particular round, but we'll continue to look on how we need to roll it out.
That's right. And we'll be looking at needs here in the ACT. So again, needs are varied across trial sites. If you think about the South Australian context where we've had very young children coming in first, as it turned out, that was quite difficult because parents are often dealing with the grief of having a newly diagnosed child. There's often a lot of medical intervention that happens in those early days to get the child well. And so it wasn't the right time for them to be coming in and thinking about their child's long-term goals or even to be thinking about a plan. They're just, dealing with the day-to-day. The second part is the supports that people might already be receiving, and these are the informal unpaid supports. So supports provided by community, by mainstream, by families, carers, relatives, circles of support, etc. All of those get set out in the plan. And then the third part is the actual NDIS funded supports, and people will have a budget, they'll know exactly what they're up for. I won't say much more about this except these are really important. These are really important. It goes back to that point I was trying to make before about, this is everybody's responsibility. It's not just the NDIA's, it's everybody's responsibility. And in terms of carers, because I'm sure many of you will also be connected with families and carers of people with disability, they have often borne the brunt of supporting that person, often over a lifetime. We know we've got quite a lot of elderly carers in the ACT who are very concerned about what this scheme is going to mean for their child, their son or daughter. And there is a component of the planning where parents can have a separate conversation with the planner. So although the intent is always to involve the person with disability in everything, nothing about us without us, I think is what they say, but there obviously will be a place for planners to have a separate conversation with carers or parents if that's appropriate. We want to make sure that carers are supported in their role. And so while we wouldn't directly fund a carer for X or Y, we can put supports in a plan that will make sure that carers get a break from their caring duties. That's always been called respite in the past. I don't know why that term's necessarily fallen out of favour, but nobody seems to like it anymore. I mean, in many cases it can be a break for the person with disability as well as the parent or carer, but those kind of breaks. But the other thing it can include is referral to other agencies for support outside the NDIA, and it can also include paying for training courses. So there obviously will be a place for carers needing to do X or Y to increase their capacity to care for the person, and the NDIA can pay for that. That's not the extent of it. You can read about that rule on the NDIS website. So learning is going to be absolutely crucial. So we like to think of ourselves as a learning organisation. Learning that's based on experience will absolutely lead to improvement. I think that's the only way we can do it. We're very open to feedback. So at the moment we've got several mechanisms that people can use to give us feedback. Each of the trial sites has its own mechanism for receiving feedback from their participants, from carers, from family, from the general public, as well as us having a national way of collecting that. We have a 1-800 number that operates every day of the week, except, not Saturdays and Sundays, sorry, I shouldn't tell you that. Operates every day, but I think it's 8 to 8, 8 a.m. to 8 p.m. to take into account the WA trial sites starting in July. You can ring them up and give them feedback. There are complaints forms on the website that you can fill in if you've got a complaint, and if you've got something nice to say, of course, we'd like to hear about that too. So this is really important for you. I'm not sure about the extent to which the ACT will necessarily reflect this experience from our existing trial sites, because based on the feedback and the early trends from the first 6 months of operation, we've made some adjustments already to our processes and systems to make things easier. So clearly, expectations about the scheme and what it will deliver are very high, and they are high everywhere, not just in the disability community, but in the community generally, I think. And this is another area where support workers are going to be just so important. So you have direct access to people who are likely to enter the scheme. Managing people's expectations is going to be really important. So by educating yourself about the scheme, by knowing that it's permanent disability, that has a significant impact, that it's about increasing participation. It's not about going to the moon, it's about increasing participation in the community. You will help to manage expectations for scheme participants. We've had a lot more access requests come in than we anticipated, and the time taken to finalise plans has been longer than expected, and that's going back to those complicating factors like in South Australia, but mainly it has been around the fact that people have needed much, much longer to think about their goals and to unpack their goals. And the number of people entering the scheme, at least up until the end of December, was lower than expected. But as I say, since then, there's been a real pick-up in the number of plans being completed. And both participants and staff have identified a number of areas where things could have been improved, and in fact, those improvements have been made. So to be successful, these are the things that we, and I mean collectively we, the royal we, that's everybody, needs to keep in mind. Those three pillars need to be kept in balance: the insurance approach, choice and control, community and mainstream. We need to ensure that the funding for the scheme is sustainable. So there's been a funding envelope identified by the time we get to full scheme rollout, which is $22 billion a year. It's a lot of money. You could have a lot of trips to Disneyland for that. But it is a lot of money. It's about a doubling of what currently goes into the disability sector now. So certainly there will be a lot more funding available, and that's good news. But it also means that we need to keep an eye on making sure we're delivering the scheme within that funding envelope, and that's what our scheme actuaries will be doing. We need to make sure that the delivery is efficient and effective. And again, you know, in the ACT, we might come up against things that we haven't already uncovered in the existing trial sites and be able to make improvements here that means that the process is even more streamlined for people with disability. I certainly hope so. And it has to improve outcomes. It has to. If it doesn't, we've all failed. You know, we've all failed. So this is what's happened so far. There's been a stronger emphasis on the evidence-based approach for change. We've streamlined the process for determining whether somebody might be able to access the scheme, and that's made a big difference. There's much better guidance for our decision makers. So in terms of who are the decision makers in the agency about what a person gets and so on, it's our planners. So we have people who have the delegated authority from the CEO to make decisions about what somebody can have in their plan. Much better communication, I hope, with the community so that they understand what reasonable and necessary means. And we're streamlining our admin and plan implementation to reduce the burden on NDIA staff. We're building sector capacity. I won't go into all of this, you can find it on the website. We ran a round called Practical Design Fund at the beginning, I think, of end of 2012, and all of the projects that have been finalised, you can find them on the website if you're interested to see what they came up with. We had a conference last year, that's old news, God, nearly a year ago, and Sector Development Fund, and this is where the capacity building strategy grants come in. So I mentioned them earlier, worth going on the website to have a look at those. And transition will be gradual, so there'll be this gradual transition. I'm not exactly sure how, it's almost like a magic box at the moment, but just to reassure you, next time we come back we'll be able to tell you all about that. Wide gateway, so I mentioned the web, the call centre, the 1800 number, the shop fronts. Anybody can turn up to a regional shop front at any time, so once the doors open on the 1st of July here, you're very welcome just to come in and visit us. There are information products being developed now for our ACT audiences, and we don't just print them in hard copy, everything also goes up on the web. So if you were ever looking for a copy of something, you could just go to the web and print one off from there. We'll have products going out to our prospective participants once our phasing is known, and we are working on a planning kit and a plan implementation kit for people who become participants in the scheme. There's still quite a bit of work to do. I try not to think about it. I think just get through today, it'll be fine. But as I said before, there'll be a continual rolling program of community engagement, so just look out for that. Again, it'll all be on the website, the schedules. If any of you are signed up to the newsletter, so it's free, an electronic newsletter. If you haven't, go to our website and sign up for that. There'll be a gradual movement of national office staff from Canberra to Geelong by the end of June. So obviously the ACT trial site staff are staying here because we need to be on the ground, but almost everybody else is going to national office in Geelong. We're preparing for that formal evaluation, an external, independently conducted evaluation of the scheme that will be starting soon. And this is part of our preparation of people and organisations in the ACT for 2014. And that's probably as much as I wanted to say. I could keep going, but you might have some questions. Yes?
I've been wondering all throughout, because I work for Disability ACT,
yes.
We're a support organisation.
Yes.
I know there are NGOs who also offer
yep.
support. And I know there are people out in the community who would like to access support systems.
Mm-hmm. Who aren't currently?
Yes.
Who aren't currently, yes. Yep.
So are they going to be preferenced? Is there any strategy for the people who are in support?
Yes.
Are they going to be put on the back burner?
That is part of that phasing discussion that I was mentioning before. So, yes. Oh, sorry. So the question was, what happens with people who are not currently receiving any government-funded supports? And I'm sure you all know people like that. I can only speak about the experience in the trial sites to date. So absolutely that's recognised. There'll be a component of people in the ACT who will be able to access the scheme because they'll meet the access requirements, who are not currently receiving any government-funded supports. So they've been referred to in the other trial sites as new clients, only because they're not currently receiving any government-funded supports. I don't know exactly what's going to happen in the ACT. They will be able to access the scheme. There's nothing that will prevent them from doing that. But exactly how and when they will be phased in here, I don't know. In the other trial sites, anybody who was currently receiving support from any government-funded scheme, we could identify those people either directly or through their current providers, and so we were able to get in contact with them. But of course, the people we don't know, we don't know. And so if you know anybody like that, tell them to contact the agency after the 1st of July. Tell them to go to the website, do the My Access Checker. And if you just say to them, look, we don't know at the moment how new people are going to be brought in, but we should know that very soon. In the other trial sites, what they did was allow people who were new clients to contact the agency at any time. So provided they were in the trial site, they were living there, they met the access requirements, they could contact the agency at any time. Yeah. Yes?
I've got two questions.
Yes?
My first question is about, are other supports like the disability pension, Better Start, all of those kinds of supports,
yes.
will they be affected by NDIS?
Okay, so the question was, will other forms of support like the disability support pension, Better Start and the HAQA funding? So I used to actually, I started the Better Start program. Don't hit me, but I implemented that program. So they're two very different things. So I'll deal with the DSP first. I want you to hear this message once only. The DSP is not affected by the NDIS. And the reason is the disability support pension is income support. It's a completely different category of support to support that people get under the NDIS. The NDIS is about disability supports to increase participation. It's not about paying for rent or food or any of the normal expenses of daily living, which is what the DSP is for. So, you know, anybody who's on a DSP, they need fear not. It won't be affected at all by them becoming a participant. That's a really important point.
They can still access funding through the NDIS.
Exactly as they do now. They will continue to get their DSP. That is their income, you know. The other one, HACWA and Better Start, so Helping Children with Autism and the Better Start programs, it was one of the programs identified as in scope. So there's another bit of jargon for you. An in-scope disability program. All jurisdictions went through a process of identifying every funding stream that was disability support. And there's a long list for each jurisdiction. The ACT went through the same kind of process. The intention is eventually that all of those funding sources will roll into the NDIS, but it's happening in a gradual way. So obviously you just can't unpick all of those arrangements immediately. Some of you will work for providers, for example, who are block grant funded. So in the other jurisdictions, it wasn't possible to just simply undo all of those arrangements for the 1st of July. Some people were contracted, for example, till end of June 2015. So you can't just say, sorry guys, we're ripping the money off you. So it's going to be a gradual thing. In South Australia, which is probably the best example because they're dealing with children in that age group right now, as parents have had their planning conversation with the agency, they lose access to Better Start and Helping Children with Autism, which makes sense because NDIS will provide the disability supports that that child will need. Yeah.
The other
Yes.
question I've got around, you know, when you were talking about potentially the need for support increasing for centres.
Yep.
So when there are situations that mean that the disability and ageing supports kind of meet, is that distinguished?
I'm not sure I understand the question.
I'm thinking of, say, someone with Down syndrome, for example.
Down syndrome, yep.
Where perhaps the incidence of Alzheimer's or something like that may increase.
Oh, I see, yeah.
Those supports related to the onset of Alzheimer's.
Yes.
Is that distinguished separately from disability?
Probably not. I mean, that would be just another thread to that person's level of disability. So if they're already a participant in the scheme and they needed additional disability supports because of early onset Alzheimer's or whatever, that could be part of their plan.
Okay, so
yeah.
it's all encompassing.
Yes, that's right. I mean, there is a distinction. I need to be a bit careful here because I'm not a doctor. There is a distinction between supports provided through the health system, which are about medical complaints that need medical treatment, visit to doctors, hospital admissions, that kind of thing, which should rightly be paid for by the health system. But anything else which is about supporting that person to participate, to go to work, to be at home, to do the shopping, whatever, that's the NDIS's responsibility. So there is a rule called support for participants, which is worth looking at because you can understand there are a number of those interfaces where there needs to be some discussion in every jurisdiction about how that will actually operate. Very, not necessarily black and white, but anything that had an impact on their level of disability, I'm sure would be managed as part of their plan. Yeah. So you had a question, and then we'll go you, and then you.
I'm just thinking in my mind about insurance.
Yes.
In my mind, my insurance covers certain things.
Yes.
Medicare covers
Certain things, yeah.
And the way it works is that if I have an issue and I go see a doctor and I get an invoice or receipt or
Yes.
whatever, and I take
Yeah.
it to Medicare
Yeah.
and they partially cover it.
That's right, and then you pay the gap.
Yeah.
Yeah.
So with the NDIS, the person then goes to the planner.
Yes.
They are suggested. I mean, they come up with a plan.
Yes.
And they are allocated a certain amount of funding.
Yep.
Now, that's a big bunch of money. Say it's $35,000.
Yeah.
Is that for the year? Is that for those things that they've identified that they want? Do you go back and say, look, this is not working for me, I need a change? or I've finished that and
Yes.
I need something else.
Yes.
You know, is that all stuff that still needs to be worked out? Or
No,
I'm just thinking,
no.
like, it's an
Yes,
insurance model?
It's an insurance model, that's right, but it's an uncapped scheme. So the question was, a person goes along, they get a plan, they get a certain amount of money allocated. Is that annually? What happens if they spend it faster than the year? What happens if they need more? Would they be the main points? Yeah. And what happens if they want something and it's much more expensive, I think was the other thing I was reading into there. So let's just look at that. So the plan is constructed on a person's anticipated disability support needs, usually over a 12-month period, usually, but it can be a shorter period than that, and a review date could be built in earlier if that was felt that was necessary. So normally that money would be for the disability supports required by that person for an annual period. Yep. If the person is self-managing their funding, and at the moment only about 10% of people choose to actually actively manage their funds themselves. Can you imagine the burden? I wouldn't want to do it. But say they were managing their $35,000, they don't get $35,000 paid in one go. It's worked out between the planner and the person how often they might get paid. Generally, I think it's about monthly, so they'll get an allocation monthly, and that's to pay for their supports for that month. If they don't spend that money gets rolled into the next allocation. So if you don't spend it, there's no need to save. I mean, this is another message to get out there. You don't need to hoard your disability support money because you think you might like to do something next month. You need to actually think about what you're going to need month by month. For people who are not self-managing, what happens is the provider invoices the agency directly for the supports that are providing. So they never see the money, they just get the supports, the provider accesses through the provider portal, and they get paid within a couple of days of submitting the invoice. But the people can still go into their plan and see what's been provided by whom and what the cost was. In terms of the way the pricing structures worked, we had people working in every jurisdiction to kind of come up with what were the prices being paid locally. So in fact, they're slightly different in every jurisdiction. We didn't want to disturb any local markets, but wanted to make sure that people were being paid properly for the supports that they were receiving, so the plans are calculated on that. And if a person got halfway through the month, say they were self-managing and they'd spent all their money, that would be picked up very quickly, and we'd need to work with them to make sure that, their plan did fit what they needed, and maybe it does need some adjustment. So in a sense, there's enough flexibility in the scheme to make sure that people's needs are being met. The plans will match their needs. The payments that they're getting should actually match the supports that they're receiving. And somebody is looking at that data all the time. Who would want to be an actuary, honest to God? But that's what they're looking at all the time, to make sure that plans, supports in there, dollars going out are all lining up. In cases where people want something that's, say, I'll use a frivolous example. Say somebody wanted a platinum-plated, turbocharged wheelchair, if there even is such a thing. When somebody needs a really expensive piece of equipment or a very unusual support, or maybe something that's innovative or new or hasn't been tried before, what's called a benchmark price will go into their plan. So that goes in as a benchmark price. And then quotes will be sought. So we're talking about vehicle modifications, home modifications, very expensive pieces of equipment. And the prices will come back. And say the person that comes back, this one's really good, and this is what we'll pay. If the person wants the next one up and they're determined to have that, they can pay the difference. Yeah. Just as you would, with other things. Yeah.
Apply to services as well in terms of co-payment?
It could apply to services. I just don't know of any instances where that has happened. But it's possible that that could happen. If somebody really wanted a AAA platinum plated service for something, and they could justify that that's what they needed.
If the service provider provides a particular and guarantees a particular service that is to that person, not so they guarantee a particular support worker or a particular pool of support workers that person specifically wants to access, it might cost them more.
Yes.
But they feel that is what is going to make their...
And they're happy to pay whatever the premium is. Yes, that's right. I just can't give you an example, but I can't see that wouldn't be something that wouldn't be considered. Yeah. So we're going here and then here and then here.
For learning reason, I
yes.
want to know why did you cut off assistance at age 65?
Okay. Yes, I'll talk about that. Yep.
Number two, you have, I can think of at least maybe about 3 people
yes.
who are in accommodation support,
yes.
already getting quite a bit of
yes.
funding,
yes.
who are already heading into the 65 very
yes.
soon.
Yes.
I think they're also running into dementia because of the condition.
Yes.
So what happens?
Yeah.
Thirdly, is it right to say the NDIS agency actually targeting the newer people who have had no support at all?
Yeah.
Or are you still looking at those who are having some privileges
yes.
in the accommodation support? Does it make sense?
Yes, it does. So the first question was, why does it cut off at 65? So I'll start with that one. That's a policy decision about this scheme really being for people who are not aged. And so we have an aged care system that kicks in when people turn 65. But the very important thing for you, all of you, to know is if any of your participants under 65 come into the scheme, when they get to 65, they can choose to remain in the NDIS, so remain a participant in the scheme, or to transition to the aged care system. So once you're in there, that choice is there once they turn 65. In a sense, it is about managing those boundaries. We are, again, that's one of those interface issues. So when you're 65, if you need it, you can enter the aged care system. You go into residential aged care if that's what you need. So there's no point having 2 systems running parallel. But if you've got somebody in the scheme under 65 who's quite well, who doesn't need that, they can choose to remain in the scheme. The second one was about people in residential aged care who are coming up to 65.
No, we're in accommodation.
Who are in supported accommodation, who are coming up to 65. So again, that is part of that phasing issue. Clearly the ACT government is aware that there are some people coming up to 65 for whom it might be beneficial to come into the scheme. So I know that is being thought about, and that's probably as much as I can say about that. And the third thing was... No, I can't remember.
Is this agency looking at new people, the new faces who have never had any kind of support, which are quite plentiful in the ACT,
yes.
I understand?
Yes.
Or are they still going to concentrate on people who have got some benefits,
yes.
but need to be more open to community participation and
yes.
mainstream?
Yes.
Which way does it?
Yeah, and again, I can't answer that at the moment. So I think I talked about the trial site experience so far. So anybody who fell into that category of not receiving any support, they could contact the agency the moment the 1st of July clicked over and they could enter the scheme. But in the ACT, that phasing is still to be determined. But there's another question I can hear in there, which is about the importance of connecting people not just to disability supports but also to those other things. And so you will get a certain proportion of people coming in who certainly have a permanent disability, whose impact of the disability is certainly significant, but who might not need very much. And it might be much more about connecting them in a better, more effective and sustainable way to community and mainstream supports rather than funded supports. Yeah. This one?
Yeah, a quick question. Does the scheme cover illnesses such as cancer, things like that?
No.
Whether they be short or long term?
Yeah, no. So this is that interface issue. So the question was, does NDIS cover cancer and illnesses like that? And the answer is no. Right. And the reason is that, again, it's that interface issue with health. So if you have a health condition that's managed largely in the health sector, even though it can have a disabling effect, it's still really about managing that condition in the health sector, And look, again, it's not all black and white. There may be some instances where it's a combination of disability and a medical condition, but our planners are going to, they'll look at all of that. Yeah. Sorry, and you had a question.
I have two or three, the two of them quick.
Yep.
One was the means testing.
It's not means tested.
So there's no, how much money?
Not means tested.
There's no means testing.
No.
The other one was the mobility allowance.
No, mobility allowance was one of those in-scope programs. So one of those programs, it's a federal program, mobility allowance. It was identified as an in-scope program, which means that eventually all of that money will roll into the NDIS. For people who are currently receiving it, they'll continue to receive it until the point they transition into the scheme, and then it's taken care of in their support plan. Yeah.
Thank you. The third part, was the concern that a lot of us had.
Yes.
We have someone who is actually over 65.
Yes.
They've agreed to keep funding him as we community access.
Right.
Program.
Yep.
But with the NDIS, if he can't access that because of his age, we just don't know where to find community access for him.
Yeah.
Aged care, a lot of the programs are for elderly people.
Yes. Yeah.
They all are, of course. But his disability can make him quite disruptive. So they really don't want him. People just don't want him.
Yes.
And won't have him in their program.
Yeah.
So we're at a real loss.
So again, I come back to this agreement between all governments about continuity of support. He won't be the only person who is currently receiving disability supports who won't be able to access the scheme. And governments have agreed that where that's the case, they will continue to provide continuity of support for people like that.
Oh, okay.
Yeah. Now, who was next? Yes, up the back.
Quickly ask, it relates to that one. Is there a list of in-scope programs?
Yes, there is. Well, there was a whole list of all of the in-scope programs for, I don't know, have you published your list? No.
Just the scheme schedule.
Okay. For the ACT? No, the national one. So on the COAG website are all the intergovernmental agreements. So that identification of in-scope programs happened as part of that intergovernmental agreement. So you can find the list there. Yes?
There was some political rattlings about Medicare being privatised. Would that have any impact?
No, it shouldn't.
Medibank private.
Oh, Medibank private. No, that's a different thing altogether. People sign up to that privately anyway. It doesn't affect Medicare itself. It's, nothing to do with it. Yeah.
I mean, I haven't really looked at it comprehensively.
Yeah. No, you can just forget about worrying about that one. Yes.
So what about those people who are currently funded now through a block program, so they're
Yes.
involved with a block program,
Yep.
but then when it comes to the NDIS, they may not be eligible to access the NDIS. What
Mhm.
happens to those people?
Again, coming back to that idea of continuity of support, there will be people that you work with who possibly will not be able to access the scheme, and all governments have agreed where supports are being provided to somebody who's not then able to access the scheme, they can continue to access the supports they're receiving now.
So does that mean for block funding programs, you know how you were saying that block funding programs are going to be phased?
Eventually,
or
in the longer
whatever-
term, yeah.
whatever you
Yep.
used. What happens then? You know what I'm saying? Because
I
there are
do.
people that won't fit.
Yes, there are.
And won't
Yep.
fit, and
Yep.
probably particularly around some mental health stuff as well.
Yeah, yeah.
What happens?
Yep.
What happens there? Block funding is going to be
Yes, eventually.
done.
It is true. So for most programs where the funding is provided through block grant funding, most of that will be unpicked. But what we don't know in the ACT is really what the environment's going to look like here in the longer term. And all jurisdictions have got an eye to the fact that, look, there might be a case in some instances for some programs still to be block funded, because each person who's a participant in that program takes a tiny, tiny slice of it. It might not make sense to then make that an individual support that's included in their plan. But this is something that, we'll be looking at very carefully over the next couple of years, particularly in the ACT. Yeah. Yes.
How will you identify those people?
Well, that's a good question.
The
So they're not
people who
presenting-
don't fit, who are currently in block funding,
Yes.
don't fit but would really like to or
Yeah.
need to continue with that.
Well, a couple of ways I can think of. So they might come into the shopfront. they might do the My Access checker and find that they're not able to access the scheme. But there is an area of concentration, which is those people who have disabilities who are not able to access the scheme. In other words, it's not permanent and or it's not significant enough, or they don't meet the early intervention requirements. And some support can still be provided to those people. It's been called Tier 2 up until now. It's a horrible term, but you know, people with disability who don't meet the access requirements. And so just exactly how that will work in the longer term, I don't know. Yeah.
Can I just add something there? One of the things about the ACT is it's really a very small community. We're talking about 65 or so specialist disability services that are currently working with people with disability or psychosocial disability that are likely to be impacted and phase into the National Disability Insurance Scheme. You know the people that you're working with, your managers know the people that your organisation is working with better than anybody else. So we're going to know if people are phasing in. We'll be able to say exactly who will phase in at what point. Your organisations will know that information. In the next few weeks, you'll be able to see exactly who and how and when. And we'll be working with you, with your organisations, to enable that to happen as smoothly as possible. So it is a good thing. We're a small community. If there are 5 or 6 people, for example, in a particular program that aren't going to move over, then we need to work with your organisation to ensure that there is that continuity of support.
Yes.
Wondering, will NDIS funding replace government funding in future? For example, some clients they probably receive support from our organisation at the moment, and because we have government funding, but they don't have individual funding. And in future, if they're not eligible for the NDIS, will they still get service? Yes. So yes. So well, I don't know exactly where the money is going to come from. I'm going to buy a lotto ticket. No, I don't know exactly because those arrangements are still being worked at. But that is essentially the same question as I've had a few times now about continuity of support. There is no doubt that a proportion of the people you work with will not be able to access the scheme because they won't meet the access requirements. But all governments do recognise this. All of them have said that they are absolutely committed to provide continuity of support, whatever that looks like. So those discussions are happening now for the ACT. Yeah. What I can tell you is it hasn't proved to be too much of a problem anywhere else. So that to me is a good sign. You know, it seems to me we are targeting the people we ought to be targeting. And it just doesn't seem to have been a problem across the existing sites. Yeah. And the second question is, some clients, they receive service from different organisations, like accommodation and advance support. Yes. When they apply for funding for NDIS, who will help them to how to apply? Like, will they apply separately? No. This is one of the big things. So, yes, in the past it meant you applied here and you got a little bit of this, and then you applied here and you got a little bit of this. No more. You come to the NDIS, your package of supports is constructed. The people who work for the agency will connect you with providers if you've not previously been connected with them, or if you want to stay with the same providers because you're happy with what they're providing and how they're providing it, that is also possible. But it's a single application form, a single plan, a single conduit. Does that mean the client need to apply for funding with their family's help? They can. Service provider help them, and the planner you mean in the past. Who is the planner? Only the planner with your organization. Yes, with the NDIA. Yeah. Does that mean like if as a service provider, if we need to help clients to apply for NDIS funding, do we need to have a big meeting with all the service providers and the stars? No. So essentially it will either be the person themselves who is applying for access to the scheme. Families and carers are going to be in there, of course, for many people.
and probably a lesser proportion will have no, significant person in their lives to help them. In that case, it could be a service provider. Essentially, it's up to the person themselves. So whoever that person wants to help them with the process and to help them with the planning process, it's open to them. People have had advocates, formal advocates come with them. They've had a nominee or a guardian, through that process.
Like us helping families with DSOs and things like that.
Yes. Yes.
Yeah, the families get the parents too old, so
yes, yeah.
Technology
yeah.
system, it's really hard for
yes,
them to understand.
Indeed. And for those, very rare instances where you might have a client who has no other significant person in their life, under our legislation, the NDIA can appoint a nominee on their behalf. So we also have that as a possibility. Yeah.
Sorry.
Yes.
When someone goes on and does the check,
the My Access checker, yep.
Does that and it says whether they are or aren't?
Yes.
Whether they are, does that trigger the department or the? Sorry, I'm
yes.
not sure what you're calling it. But does that trigger them to send them a letter, or is it just give them the reference number to come in?
No, it's a bit more complicated than
I'm
that.
sure it
So once we've got the phasing,
yeah.
once we know what the phasing is, the messages on the My Access checker will be slightly altered so that people will get a much better sense of when they're likely to come in.
Yeah.
For the moment, because we don't have that detail, it just says contact us after the 1st of July. And as I said, it generates a unique reference number. And once that's entered in after the 1st of July, it pulls up the information that person has provided. That's why it's important to keep it. But look, if you lose it, doesn't matter. You can do it again. Post 1 July, yes, it probably will. It might say contact the 1-800 number to make an appointment, for example, which is what happens in some of the other trial sites.
So it's still driven by the person that's doing the checking? By the person
for the moment it is, yes. But remember I said, once we know with some reliable certainty who is coming in what order, we will write to them directly. Yeah. So they'll have that contact as well.
But 1 year.
Yes.
1 year.
Okay.
That's probably
okay, all right.
Can I ask about the goals?
Yes.
Do you have a client that comes in to do their planning?
Yes.
Who says, my goal is to go on a world cruise?
Yeah, great.
Which is great.
Yeah, great.
But they don't acknowledge that they can't get out of bed or they can't shower or whatever. But they're adamant that's their goal.
Right. That sounds very tricky.
Yeah. But it possibly can happen.
Possibly can happen.
Because people's goals are very different to their practicalities.
Indeed. Yeah. And this in a sense comes back to what I was trying to say before, but probably didn't say very well. The whole issue about goal setting is quite problematic for people with disabilities. So that to me is like a flight of fancy almost. I'd like to go on a world cruise. The steps between where that person is now and getting to that goal seem very long, at least to me. Even for me, thinking about going on a world cruise is, a very long distant goal. So doing some pre-planning with families and participants well before they get to the first planning session is our goal, so that people understand what a goal is and how it's achievable, and understanding the steps and what it is the agency can actually provide to people to help them achieve their goals is going to be very important.
I'm just wondering about how well the planners actually get to know the people. Are interviews done at home?
Yep, they can be, absolutely. So if I didn't say that before, although we've got shop fronts, our planners spend 70 to 80% of their time out of the office.
That's very different from somebody coming into an office.
Very, very different, I agree. Yeah. No, that's exactly right. So most people prefer to have their planning and assessment conversations off-site, which is absolutely fine. Some people like to come in because it gives them a break from the rest of their world. But, if people want to have their planning and assessment conversations in a coffee shop or local library or, whatever, it's all fine. Yeah.
Just going on a little bit from that question.
Yes.
My question is around, will there be some kind of registration process for service providers?
Yes.
To kind of regulate?
Yes.
The
yes.
So I imagine there could be the potential for there to be some flooding.
Some snake oil salesmen, maybe.
And so how, particularly with planners around.
Yes.
Yes.
So yes, providers who want to connect with NDIA participants who are not self-managing. So people who are self-managing can really buy their services from anywhere they choose. But as I said, the majority of people, up to 90%, are choosing to allow the NDIA to manage their resources, which is much less burdensome on them. And that means we have to have a process of registering and being able to say, yes, this is a legitimate provider. So in the other sites, I think the registration process opened in about early May, which was very late, but we're hoping to open it a bit sooner in the ACT. There is a process. For the moment, in each of the jurisdictions, we've accepted the existing quality assurance processes that are in place for those providers. But in the longer term, the agency is going to be working on a nationally consistent accreditation and quality assurance process. That is a longer term piece of work. Couldn't have that in place for the 1st of July last year, but it's certainly underway now. All right. This one and then back.
No, sorry.
On? Okay.
Peach, blue, then
Peach.
I
Okay.
forgot what it was now. Just with the access questionnaire.
Yes.
So you're obviously putting your name and everything in there.
Only your first name. So it doesn't collect a lot of demographic data. This was the idea, so that we didn't want to have risks with people's personal information.
Oh, okay, because that was going to be my question. If that comes up and says, no, you're not eligible, there's some recourse for appeal and to go further.
Oh, certainly. Say,
sorry, this is you and you're out.
No. I mean, there will be some things that will be very hard and fast. So somebody from YAS, for example, they're not eligible. They have to meet the basic access requirements. But if it comes up, it doesn't usually say, unless it's one of those hard and fast things, that you're not in jurisdiction, you're not a person with disability, etc., etc. It will say it does not appear, and then still invite them to contact after the 1st of July. Yes.
So I wanted to ask around the experience that you've had in other places so far around people with very serious mental illness.
Yes.
And especially maybe if there's a lack of insight
and
the families can or services are needed for real support.
Yes.
But the person maybe isn't able to really engage with the process. Maybe people who are homeless, for example. What's happening with those very disabled?
I actually don't have anything I can share with you. I think after the last one, this also came up. And I said I was going to ask my colleagues in each of the existing trial sites about whether they've got any examples, so I will still do that. I don't have anything specific I can share with you about that.
The numbers, like to me 5,000 in the ACT maybe doesn't sound that big, and have those people kind of been counted in those numbers?
Well, I expect so,
I just in terms of looking at what the projected population is for the ACT, we look at who's currently assisted by the service system, and there is about 2,500 people, roughly, there's different figures, that are currently accessing formal support services. So actually getting to 5,000 or 5,075 is a significant increase in the number of people that would be able to be or expected to be eligible for services. When we've looked at who's in the service system and who should be eligible, we've looked across the HAC, the Home and Community Care Program, we've looked into the mental health services to look for those people who would indicate to have a disability needs related to psychosocial disability or support needs, as opposed to those people who are unwell or have health needs related to their psychosocial disability. And the numbers we've had in the ACT, I think, is a projection of about 950 people that would be eligible. So we've actually got a lot of scope to ensure that everybody who it certainly will be, more people will be accessing services than currently. So,
and you had a question?
Yeah, the people that are self-managing.
Yes.
Are they required to just select a provider that's registered with you?
No. No, they can select outside. This is one.
Come like buy everywhere.
It does become buyer beware, certainly, and I mean this is one of the complicating factors. In an ideal world, everybody would be self-managing and have the broadest flexibility about selecting who provided their services and how. But the reality is, it's only people who are self-managing that will have that very high level of flexibility. Those who choose to self-manage, the experience has been so far that most of them are people who've got the skills to do that. Many people will select not to do it because, and actually even people who've got the skills to do it sometimes don't want to do it, just because of the sheer amount of work involved. But yes, it does become buyer beware. Yep.
The other side of that, when somebody decides to allow the NDIA to manage their
funds, yeah.
Do they then still have the choice of service provider?
Absolutely,
so
yeah.
If the service provider is registered with you,
yes,
there's no constraints put on, because in terms of we're always sort of that nominal hourly fee.
Yes,
so
yeah.
The agency won't say no. We are going to choose the most economic service for you.
Not for that. So I could talk again about the trial site experience. So in order to, I mean, it would have been very difficult for the agency at the outset to allow a completely unregulated provider market from the beginning. You can understand why that would have been problematic. We would have had no idea about what the costs were going to be. So prices were set for those high volume regular supports that everybody needs, say for example like personal care. They looked at local markets, they chose prices that were operating and existing in local markets, and that's the price. I don't know whether we're going to do the same thing in the ACT, I'm sorry. We can find that out for you. So people can, any provider who's registered to deliver services in the ACT, if a person's got a package where they see, they need X number of personal support hours a week, they can choose from the personal support providers that are there. It's only where they're self-managing that they can choose outside, because we have to have some way of connecting the participant with the providers to allow that invisible back-of-house payment to occur.
It was just last year, one of the things that stuck in my mind was somebody said that the disability care, as it was then, would become the largest purchaser of services in the country.
Yes, no.
I have to say that
no, we don't purchase services.
There was an indication given that they would choose what was reasonable and necessary.
Yes.
And that if there were two services provided and at the outset they looked to be about the same, then they would choose the cheaper one. But that, of course, affects that thing of choice.
Yes, it does.
People have a service provider they want to use.
I think that was more to do with those high cost services. So if there were two that were appropriate, yes, when we're talking about the platinum plated turbocharged wheelchair, they'd choose the one that was appropriate and fit for purpose and reasonable and necessary. If the person wanted the next level up, then they could pay the difference. Yeah, co-payments are a possibility, yeah. Sorry? Yeah, and in kind. So, we talked about how some of the block grant funding cannot be unbundled for the commencement of the scheme here in the ACT. So there will be some providers who continue to be block grant funded, as they are in the existing trial sites. And people can still choose to they can use that, and if they're already receiving services, they can stay with their provider. But they don't get paid for that because they're already being paid. If that person's already a client and they're receiving service, they're still being paid. And so they have to, an amount of money, which is the in-kind amount that they're contributing to the scheme, is allocated and set. And then as clients use up that in-kind money, people who are participants in the scheme, and they get to the ceiling, then they can take on new clients and be paid for those additional sessions of service. So that's a sort of a layperson's guide of how in-kind works. Yep. One more question, I think.
I just want to know, under the NDIS agency, under this scheme,
yes,
how does it affect the support workers like that? We have two categories, the governmental support workers and the non-agency support workers.
Yes. Yeah.
Do you have a fixed rate for them, or is it actually...
Depends on what services are being provided, but and again, I just don't know in the ACT whether we're going to fix prices. The CEO is wanting to move to an unregulated market. I mean, that is the way you get best competition, absolutely.
Unregulated
But
or
unregulated, where we don't set prices anymore. But at the moment we are setting prices, and I don't know whether we're setting prices in the ACT.
No, I'm not going to talk about setting prices, but just in terms of employment conditions. If you're employed by an organisation now, you'd be covered by an award, and those award conditions would be remain in place. So most people are employed under an agreement of some form, and that would stay in place. And if you choose to move to a different organisation, you'd be covered by the awards and conditions of that employment.
All right, one last one. All right, two last ones. That's it. All right, two more.
Just a really quick.
Okay.
Our friends that are just out of the ACT,
yes.
Cornwall or Queanbeyan.
Yes.
Is there any idea of when they might be?
No. So that discussion with jurisdictions about how and where the rollout will continue beyond the trial period is happening now. But that's going to be very complex. You know, we're going to move from the end of the third year from about 35,000 people into the scheme up to very rapidly around 450,000 people. So I just can't get my head around that. But that discussion is happening now about where and how. Yep. And last one, lucky last.
About the
self-managing, yep.
I got a client's mother. She told me she would like to purchase the personal care service from a particular nurse.
Yes.
But the nurse may not register as a service provider.
Right.
Can mother do?
If she's self-managing, yes, she would be able to purchase that.
And individual register as a service provider with NDIS.
She possibly could register as a provider. I mean, sorry?
Yeah, she needs an ABN.
Yes, to register as a basic level, yes, you would need an ABN to be able to register as a provider. And you'd have to have your own insurance. In a sense, you know, it comes to that issue about buyer beware. If you're purchasing services from somebody that has a specialist aspect to it like that, you'd need to be sure that what you're purchasing is what you're going to get. Yeah, there are on our website already, there are sample agreements for people who are self-managing. So if people are thinking about seeking services from a particular service provider, there's a template service agreement that they can use to, you know, formalise whatever the terms of that agreement are. Yeah. All right, well, thank you very much for your fantastic attention.